امشب مهمون نازنین ما دکتر کاملیا کاشانی فراهانچی که عروس دوست ما هم کلاس ما دانشکده دکتر رضا اند عذرا شایان فراهانچی هستن. مادر شوهر پدر شوهرم الان اینجا پرزنتن. کاملیا جان ایشون جلوگیری از دیابتیس صحبت میکنن که این روزا به نظر میاد که چاقی بزرگترین و مشکلترین کاندیشنیه که مریضا دارن، چون که کووید دیدیم که کسایی که چاق بودن چقدر مرتبطشون بالا بود. 65% کسایی که فوت کردن چاق بودن.
بله.
میشور که شیگو سرودت بذارین ایشون رو معرفی کنم با اجازتون. من رزومشون رو خلاصه کردم. ایژوکیشنشون سال 2000 تا 2004 توی وسترن یونیورسیتی آف هلت ساینس پومونا کالیفرنیا دکتر آف استیوپات رو گرفتن می of 2004. قبلش یونیورسیتی آف کالیفرنیا لس آنجلس UCLA بودن، بعد بچلر آف نوروساینس و قبل از اون لس آنجلس پیرس کالج بودن توی بودنتیز کالیفرنیا. She's board certified in American Board of Family Physician, American Board of Obesity Medicine. She's a member of American Osteopathic Association and Family Physician, Academy of Family Physician, and she's also a member of American Society of Bariatric Physicians and American Academy of Anti-Aging Medicine. Kamelia John, talk about it, Roger, anti-aging خواهد بود. All needed. She has honors and awards of California Academy of Family Physician poster presentation, and she had 4-point GPA on clinical rotation in Western University of Health Science. I want to Golden Key National Honor Society Award at UCLA. She was on Dean's List Award at UCLA and Alpha Gamma Sigma Permanent Membership Award. Welcome, Kamelia John. And presently she's in private practice in family medicine. Welcome, Khanum. Thank you so much. I know you're busy. You have 2 children and lovely husband, Orash John. And please, the microphone is yours.
Thank you so much. خیلی ممنون قدسی جان. Thank you for your presentation of me. I appreciate it. You humble me. So I will talk about diabetes prevention. Let me go ahead and share my screen tonight. I know most of us are physicians here tonight and Farsi speaking, but with ازتون معذرت خواهی میکنم چون که من خیلی راحت ترم که به انگلیسی توضیح بدم، مخصوصا چون که متن رو به انگلیسی نوشتم راحت تره برام. So please excuse me. I hope everybody understands.
Yes, we do. Thank you.
Okay. So diabetes prevention, this talk is not just about it. It goes mostly into the beginning parts of diabetes, how it all comes about and what we can do to stop it from further progression if it hasn't progressed too far. There's a few objectives that I have in mind. I won't go through those. Diabetes is a dysfunction of the blood sugar mainly. So the blood sugar starts rising and that's when somebody is diagnosed with diabetes. In reality, let me go back. In reality, in what we have in our blood, we have about 5 liters of blood in our body. I was going to actually bring something that describes how much is a 5 liter. So basically take 2 big 2 liter 2.5, I guess, of 2 liter sodas and make that into one. And that is how much blood we have in our body. in that amount of, in the 5 liter of blood that we have in our body, we have about a sugar cube, 4.5 grams of sugar in our blood. So that is about normal 81, and that's about, if anybody is familiar, which I'm sure most of you are familiar with, measuring the blood sugar, 81 milligram equals to 4.5 grams of sugar in the blood, which is normal. Up to about 126 in our blood sugar is normal. And 126 is about 6 grams, which is 2.5 sugar cubes. Okay, that's how much sugar we have in our blood. Now, if we get to about 600 milligrams in the blood, which is about 8 sugar cubes, that will put us in a coma. Okay, so it doesn't take much of sugar in our blood to go into a coma. So that's just to kind of give an idea of how much sugar do we actually have in our blood. So as you can see, our lives are filled with sugar nowadays. This is kind of a depiction of how much sugar you'll find in each of these. It doesn't necessarily have a specific name on it, but this is approximately how much sugar you will find in sugar cube amounts in these drinks. So it's way more than we can handle in our blood, right? So, and again, this is another one. And if you can see the broccoli has about a half a cup of chopped broccoli has about half of a sugar cube. So as you can see, it can add up. So if you're having 2 cokes a day, 2 pizzas, 2 slices, it just adds up. So this is some of the contents of common fruits. I often hear, are fruits okay in a diabetic? Fruits can be okay if the portion sizes are controlled, depending on the fruit. Fruits that are higher in sugar content should be avoided or taken in very, very small amounts. So obviously, we often eat more than just that sugar cube that we talked about that's in the blood. So how come we're not in a coma? How is this possible? And the answer is it's a hormone that we have, and it's the most important hormone in our blood, and it's insulin. So I'll go through a little bit, and I know most of you are already familiar with this, but just for our audience that are not physicians, we'll go through this. I have a few videos that kind of just goes through what happens as we eat food. Can everybody hear that? Because I've had problems with, you can hear it, okay. So as you can see, everything that we eat, finally, all the carbohydrates, whether they're complex, whether they are simple, whatever that we eat, it eventually breaks down into the molecule of glucose, which is then absorbed by the body. How quickly it breaks down into glucose is very important, because if it's quickly becoming glucose in a very short period of time, which is all of your simple carbohydrates and anything that has actual sugar in it, then it is rising our blood sugar much quicker than if it's absorbing slowly. And that is your complex carbohydrates, which is your brown rice and your whole wheat and things like that. So as we know, glucose is, it gives the body energy, and we need the energy to function. Every cell needs energy to function. So in order for this glucose to come into the cell, something important needs to happen. It does not get into the cell by itself. So the moment that we eat food and that food hits the stomach and starts going into the bloodstream, pancreas recognizes that, oh, we got glucose and other things, not just glucose, but fatty acids, anything that we eat. We need to get these into the cells. So the pancreas produces insulin. It basically senses how much glucose we have, and it produces the right amount of insulin for the glucose to enter the cells. So as it's depicted here, insulin has to go on specific receptors, which are the purple things that we call receptors. It goes on its own insulin receptors, and that sets off a cascade of events happening, which allows glucose to enter our cells. So if there is any problem with insulin being recognized by the cell, then we can have issues. So what happens to all the extra sugar that we have? So let's say that we have a meal that gives us, 100 grams of carbohydrate or sugar. We can only have 4 grams of it in our bloodstream. What's going to happen to the rest of it? So the body stores it. It stores it in the liver, in the muscle, and in the fat cells. So how it does that? In the liver, it's stored in the form of glycogen, which is just chains of glucose molecules, which when we need it, it breaks down into the actual glucose molecules, and it gets released into the blood for use by the body. So during the times that we're not eating overnight, we're fasting, this is what's happening. Anytime that we're fasting, this is what's happening. The other place that it gets stored, actually, let me go back. The liver stores about 100 grams of glucose. That's how much it's storing. So it's not really that much. It can't store more than that. The muscle also stores in the form of glycogen. Obviously, we have a lot more muscle in our body. So that all together, our muscles are able to store about, on average, 500 grams. Of course, if you have more muscle mass, you can store more. And that's why it's important to have more muscle mass. When we have less muscle mass, that is going to be much less. And that's why the recommendations for exercising right now includes strength training so that we can increase that muscle mass. So everything else other than that 500 grams and the 100 grams in the liver and the muscle, when those are full and that's done, everything else gets converted it goes into the fat cells, basically. Whether it's as glucose or fatty acids, it goes right into the fat cells. So there are 2 ways, and this is the most important part. When it comes to insulin resistant, the fat cells are the ones that really drive everything. So I'm going to spend a little bit more time on the fat cells. So as we eat more, there are 2 ways that our fat cells will react. One is that our fat cells will multiply, or our fat cells will just increase in size. So the scientific term for multiplication is hyperplasia. So we have the normal cells. Let's say we have 4 fat cells. So hyperplasia, it means that they just multiply. So now instead of 4, we have 4 fat cells, so we can store more. Hypertrophy is when those 4 fat cells are just increasing in size. So now it's holding twice as much. And this is where we run into metabolic problems and issues when the fat cells start to hypertrophy and increase in their size. Traditionally, we thought that there was no hyperplasia in fat cells. We thought that we are born with a set amount of fat cells. Since we have proven that to be wrong, and there is hyperplasia, although not doesn't happen a lot. It's not the first way that the fat wants to act, but hyperplasia does happen in fat cells. So when hyperplasia happens, when you're getting multiplication in these fat cells, as we are storing more and more energy, more and more glucose, these new fat cells are going to require new blood vessels, new circulation to be developed. So with hyperplasia, the circulation that develops, the vessels that develop are normal. The cells are all getting adequate amount of blood flow. And because of that, they do not become inflammatory until hyperplasia is done and they do not multiply anymore and they start to hypertrophy, okay? And that is something that will eventually happen in obesity. It's not always hyperplasia. Hypertrophy will be the end result. So hyperplasia is good. Now, hypertrophy, on the other hand, as these fat cells are starting to grow, they push against the blood vessels, the new blood vessels that are developing. They cause them to collapse. Therefore, they become hypoxic, lack of blood flow, lack of oxygen. This causes the tissue to become diseased. Inflammation develops in that tissue, and therefore we start getting insulin resistance. So the main driver for insulin resistance is the hypertrophy of fat cells. So if we are not gaining weight, then this should be okay. But as we start gaining weight and storing more and more, then with hypertrophy happening, then it leads into insulin resistance. Now, I should mention, where do we see more of this hypertrophy, increased size versus multiplication? We have two types of, well, we have more, but for this reason, we'll just focus on two types of fat tissue. We have the visceral adipose tissue and then the subcutaneous adipose tissue. Visceral adipose tissue generally works by hypertrophy. It is a deep abdominal fat. It's what you find if you grab your belly, you're not going to find a bunch of fat. It'll be hard, okay? That's how you know it's visceral. It's deeper inside. So visceral adipose tissue tends to hypertrophy. It doesn't multiply, and therefore it's highly inflammatory. So people that tend to have a bigger belly generally start developing insulin resistance and metabolic problems from that, versus people who have more subcutaneous adipose tissue. So two people may weigh the same amount, but one of them may have insulin resistance or diabetes, and the other one won't, because if they have more subcutaneous tissue, adipose tissue, fat tissue, this is what you find mainly under the skin, in the buttocks and hips, in the breast, in the legs and arms. So when you have more fat in those areas, that fat tends to multiply and works through hyperplasia. Therefore, it stays metabolically healthy. The reason I bring this up is to bring attention. If you tend to gain weight in the middle area, which tends to be the males generally, but women do as well, it's very genetically determined of how we gain weight. Some people don't have that much subcutaneous adipose tissue. We see this often in our Hispanic population, where they have the skinny legs and the skinny arms, and then they have that central, what we call central obesity. So in these patients, we generally, they become insulin resistant and develop diabetes much quicker. So just kind of a depiction of what we're talking about when we talk about visceral fat tissue. So the first three pictures Even though the second picture has that abdominal, you see the abdomen is enlarged, the belly is enlarged, but that is all subcutaneous fat. If it falls like that, it's subcutaneous fat. With visceral fat, it stays hard and it's under. It's not right under the skin. It's much deeper than that. Therefore, it holds its shape. I hope that explains it. Okay, now let's talk about insulin resistance and what does insulin resistance mean. Let's go through one more of these videos.
In type 2 diabetes, the cells become
So, as you can see in there, what happens is that insulin comes and it knocks at the door and says, open up for glucose. The cell turns around and says, I've had too much glucose. I do not want any more glucose. Please do not tell me to take more. So the cell basically stops listening to insulin and doesn't react to insulin when insulin comes by. So this is when insulin resistance develops. Your blood sugar is still normal, okay? So the reason the blood sugar stays normal is that obviously the body will do whatever it can to keep that normal blood sugar. So there's just more production of insulin. The pancreas is like, let's pump it out. Let's pump out this insulin. Let's get these blood sugar, let's get the blood sugar down and the glucose inside the cells. So the pancreas starts working overtime. It's tiring out, producing more and more insulin to get the glucose inside the cell forcefully, basically. So this is progression of insulin resistance. So at any time, any of these steps we can reverse, okay? So this is the progression of insulin resistance. Now our pancreas is kind of just saying, you know, we've had enough, I've had enough. I cannot produce any more insulin. Don't ask me to produce more. So it tires out, it cannot keep up with the demands. The insulin levels start to drop because the pancreas cells are now dying away. And that's the time where the blood sugar starts to rise. And that's when we call what we call prediabetes. And this progression of the pancreas just not being able to keep up and the pancreatic cells dying away, and continuous exposure to glucose, all of that will just cause the further rise of the blood sugars, therefore resulting in full-on diabetes, and therefore, and the progression of it as this continues. So just a little graph. I want you to know that there is ways to be able to tell. Unfortunately, our medical, we tend to catch things late. So by the time prediabetes comes about, we have already, it's our pancreas has become dysfunctional. By the time diabetes is diagnosed, half of our pancreas, 50%, is done. So in our medical world, we usually wait until someone is full-on diabetic before we do anything about it, before we even tell them anything. But these are things we can find out earlier. So in the first part, this is in a normal person. Insulin secretion, insulin comes as we eat, the insulin comes, okay, great, and our body is very sensitive to it. What we see in our blood results or labs, the triglycerides are normal, fasting blood sugar is normal, and our liver is normal. In insulin resistance, we see things changing. So as our body is at that insulin is pumping up, we're trying to get that glucose in there, and as that's happening, we see a rise in our triglycerides. So that's the first, usually that's what I see as the first indication that the person is becoming insulin resistant, is a rise in triglycerides and then a decline in the HDL, which is our good cholesterol. During this time is when we start seeing inflammation of the liver and fatty liver also starting. So anyone who's been told in their labs that, oh, you may have a little bit of a fatty liver or you have an inflammation in your liver and they're not a drinker, then most likely the cause of it is insulin resistance. So as it progresses into prediabetes, now we get a rise in our fasting blood sugars, but it's not enough to be called diabetes yet. At this time, our pancreas is just working so hard to release that insulin. And when it starts giving up and when the cells start dying away, that's usually when the diagnosis of diabetes happens. So you see how late we usually diagnose this disease. So going from normal to diagnosis of diabetes, that time in between generally takes anywhere between, it takes at least 5 years, let's put it that way, anywhere to 20 years, depending on the person, depending how careful they are with what they're eating, depending on where they're gaining that weight. All of that has an effect, and depending on other things that we'll explain as well later. So it's a long process. It's not something that today I'm not diabetic, tomorrow I'm diabetic. So that's one thing that I want you to realize. This process takes a long time. So anytime we step in there and want to make a change, it will help the matter. I talked about this, but this is just another depiction of if the fat cells are getting enough blood supply, the insulin resistance is happening much later. That inflammation, hypoxia, not getting enough blood flow is happening much later to where it is as they are getting bigger. So we talked about this earlier, but this was a nice depiction of it. So what are the causes of insulin resistance? We talked about diet and eating too much carbohydrates that our body can't handle. So that is called hyperinsulinemia, basically just eating too much. Results from high carbohydrate sugar diets, lack of adequate physical activity, and reduction of lean body mass or muscle mass, as I mentioned earlier. Other causes of insulin resistance is chronic inflammation. Now, there's tons of stuff in that can cause this. Actually, I got to go back right here. That causes inflammation in the body. If anybody has any autoimmune disorders that's out of control, that's your rheumatoid arthritis, your thyroid Graves' disease or Hashimoto's, and many other ones. That can cause this inflammation in the body. The inflammation can then result in earlier insulin resistance. Any type of industrial chemicals or polluted air, stress, and we'll talk about that later, lack of adequate sleep, immune system reactions to foods, having whether allergies or sensitivities to foods and you're constantly exposed to them, immune system reactions to environmental allergens. That's, if you're allergic to other things that you're continuously getting exposed to. Pro-inflammatory foods, which as discussed, that these are highly processed, high sugar, trans fats. Toxins such as heavy metals, mercury, lead, aluminum, smoking, alcohol, and obesity. There are the ones that I have in that pinkish color, orangish color. These ones are things that we can do something about. I probably should have added obesity in there, but I didn't. So these 4 things are things that we actually have control over. So if you have an autoimmune disorder, what can you do? You need to have adequate medical treatment to keep that inflammation in check. If you're exposed to polluted air, I don't know what we can do about that. There's really not too much, maybe wear a mask, but that has its problem. Now we all wear a mask. So stress management, and we will talk about that more later. Lack of adequate sleep, that's a big one. Having a good sleep hygiene, what I mean by that is going to bed at a certain time every night, making sure that you don't have any type of TV, screen, phone about half an hour to an hour before you actually are falling asleep. That has been shown to have an effect in us falling asleep because of the melatonin hormone. If you wake up in the morning and you still don't feel rested, if you're falling asleep in the middle of the day, then you need to be evaluated for what we call obstructive sleep apnea. That means that, especially if someone has obesity and higher weight, then they may not be getting enough oxygen as they're sleeping at night. So that definitely needs to be evaluated. Immune system reactions to foods, identifying food allergies and sensitivities and avoiding them, same as allergies in the environment, and using allergy reducing medications. The pro-inflammatory foods, of course, eating clean, concentrating on eating foods high in antioxidants. We can all get that information online nowadays. Our good old turmeric seems to be a big antioxidant nowadays and used heavily. Toxins, know your seafood. Some of them are very high in mercury, some fish, so know that. Of course, smoking cessation, alcohol in moderation, and I want to speak about this because nowadays our women are drinking way more than what is considered safe for them. For women, less than 7 drinks a week is considered safe. For men, it's less than 14 drinks a week. Now that's a huge difference. Women cannot handle alcohol the same way as men can. And for what I mean by a drink, it's 5 ounces of wine. That's not much. 1 ounce of hard liquor. Usually when we, pour for a shot, it's way more than 1 ounce. A regular size beer can is 1 drink. Let's see, what am I missing in there? We talked about the hard liquor, the wine. So that's what's considered a drink. So it doesn't take much to get to that 7 drinks a week. And our women are drinking much more than that nowadays. So, and can cause insulin resistance, which I consider is the mother of all diseases, is stress. Stress on its own causes insulin resistance. I was actually recently in a lecture of a PhD, which all he does is he works on insulin resistance and in cells, specific cells. And he said that when they expose a cell to either stress by the cortisol hormone, it results in insulin resistance in just a couple of hours. In 2 hours, the cell becomes insulin resistant. Same with inflammation. Inflammation takes a little longer, but stress and inflammation both cause insulin resistance on their own without overeating. So chronic stress, simply put, chronic stress causes elevated levels of cortisol, which in turn affects every aspect of our body, including resulting in insulin resistance. I know that Otsijun does a very, very good job at having lectures about stress management, and I've attended many of those lectures, which I love. And this is what's missing in our society right now. This is the key, the biggest part of our lives, learning how to manage this stress, because we all have it. So this was the NIH recommendation as far as stress management goes, is being observant, recognizing the signs of your body's, how does your body respond to stress? Is it by difficulty sleeping? Do you increase your alcohol intake, substance abuse? Are you easily angered? So recognizing that we have stress to begin with. Okay, so that's one of the most important things. If we don't recognize it, we can't do anything about it. Regular exercise, it can definitely have an effect in our cortisol levels by increasing our feel-good hormones, and it can combat stress. Try a relaxing activity. For this, everybody, for I would say everyone is different when it comes to this. There's some things that different people enjoy different types of activities. I enjoy painting, I enjoy music, dancing, but that's very different for everyone. Incorporating some meditation, that muscle relaxation, breathing exercises, making regular time for this type of activity, something relaxing. Set goals and priorities. Basically what they mean by that is don't overwhelm yourself. Say no to things that you think is, if you're feeling overwhelmed already, don't take on anymore. Prioritize and figure out what's important and then go from there. There are some things that can wait, there's some that can't. So figuring that out is the most important thing. Stay connected to family. There's a lot of people who tend to kind of just go more inward when in times of stress, and they tend to not connect as much with their loved ones and their friends. And just talking about the matter, staying connected with people that you love and you care for is one of the most important things for stress management. And of course, they had to have talked to your healthcare provider or health professional, which I have to talk about that because I think that there's a lot we can do before we go there. If you feel that there's actually depression and anxiety has set in, that has caused, that is becoming to a place where you can't even do any of those other things that I talked about, this is just becomes too overwhelming. And that's the time that healthcare provider can definitely help with some medications for depression and anxiety. Although just coming to your provider and saying, I have a lot of stress, most providers will not know what to do with that than to refer you to a therapist. So that, unfortunately, in this new age of medicine, we have 10 to 20 minutes max to spend with our patients as a primary care doctor, which makes it very, very difficult to talk about these type of things. I should say, though, there are some things that it didn't talk about here. One of the things that I do tell my patients, especially the young patients that I get in, is make a note every night, make a note of 3 things that made you grateful, made you happy, taking that focus and putting it on things that are positive in our lives. In this day and age, especially with the social media, it's so easy to notice what we don't have. And that has become a huge problem in our youth nowadays. So I tell them to take a moment at nighttime, take 5 minutes, write down three things that has made you grateful today. Even if it was just a food that you had that you liked. It can be anything, even if somebody smiled at you out of nowhere. So it can be as easy as that, because often we don't recognize the things that we have and the things that we're grateful for. We tend to not put focus on them. Anyways, this is not a discussion on stress management, but that is another talk, but I just wanted to mention a few things here. So let's go into diet, because that's the main thing that we can, actually, what's very interesting is that when I was at that lecture that I mentioned, he said, okay, yes, there is the hyperinsulinemia when we eat too much, and then there's the stress, and then there's the inflammation. And then he comes out and he says this, well, we can't do anything about the inflammation. We can't do anything about the stress. So let's focus on the diet. But I did want you to know that there is stuff that we can do about inflammation and about stress. So now let's focus on the diet. So what is a good diet? Nowadays, there is so many diets out there that it's hard to choose anything. It's confusing. Basics of any diet, okay, is to avoid or minimize highly processed foods. There's a study out there that they recently did of 2 groups of people that they kept at NIH, and they gave one group a diet of completely non-processed foods, and they gave another group processed foods. And they measured how many calories. They didn't restrict anything for them. They just gave them whatever they want, but what they had available to them was whether processed or non-processed. And then after a month, they switched the groups. So they gave the processed food now to the group that was getting non-processed foods, and vice versa. So what they found out is that on average, there was a 500 calorie increase in food consumption per day in the group that was eating the processed food. So somehow we eat more when we eat processed foods. So whether we can go into detail of what could be causing that, but we eat more when we eat processed foods. And that could be one reason why it causes weight gain. Reduce carbohydrate intake, in particular simple carbohydrates. We want to keep it complex. That means your brown rice, your potato, your sweet potatoes, your beans. All of those are more complex. Your whole wheat type of things, that's all your complex carbohydrates. Avoid foods with added sugar. Nowadays, to make things taste good, they always add more sugar into it. Even if the food already has sugar, they add more sugar into it. Luckily, what happened a couple of years ago is that FDA came and said, well, now we require that you put how many added sugars you put in there. So that information is now on the nutritional facts that you see behind boxes. So that's a good thing. Increase your vegetable intake, moderate fruit intake, minimize fruits high in sugar and low fiber. So fruits are great and wonderful if we eat the fiber with it. When we don't eat the fiber, which is then becomes your fruit juices, then that is when we're just getting pure sugar. Yeah, we're getting some vitamins, but the pure sugar does more harm in our body than the extra vitamins that we're getting from it. And then minimize oils while cooking. So oils are a very, it's a question that I'm always asked, what oil should I use? What oil should I use? And at the end of the day, any oil that we use while we're heating it up, okay, part of it is going to go trans fat and it's going to go bad. Now, oils that have a higher burning point, then those tend to be, we can cook with it. So those are going to be your avocado oil and safflower oil, not sunflower, safflower. Those we can cook at a higher heat, but at the end of the day, the more we minimize the oil that we cook with and use as little as we possibly can while we're heating that up, then we are better off because all of them turn bad. Okay, so the diets that I'm going to talk about today are low-carb diets, Mediterranean diets, and specifically to reduce insulin resistance and stop diabetes or reverse diabetes is the keto or very low carbohydrate diets. The difference between the low carb diet and a keto diet is in a keto diet, you're taking in about 20 to 50 grams of carbohydrates per day. So it's a very, very low carbohydrates. In a low carb diet, you are at 130 grams per day. So let's talk about the low carb diet here. So as I said, you're limiting your carbohydrate intake to about less than 130 grams per day. And I'm going to go into what does that mean and how much are we talking about when we talk about in different type of foods, when we talk about 130 grams. When we count that carbohydrate, you should count the total carbohydrates, not the net carbohydrates, because when you go and start reading in the back, you're going to see net carbohydrate. And usually if we do the net carbohydrate, we are taking in way too much for it to want to be considered a low-carb diet. And what a net carbohydrate means, it basically is your total carbohydrate minus the amount of fiber that food has, okay? How much protein do we need? So we need 130 grams of carbohydrates. As far as protein goes, it depends what kind of a life we have. It depends how old we are. So for people who have a sedentary lifestyle and they're not elderly, they say about 0.8 grams of protein per kilogram, or if you're doing it from pounds, it's about 0.36 grams per pound of body weight, okay? So I should have put down an example. I haven't. Let's talk about the elderly. That'll be easier to kind of calculate. The elderly need much more. So we're talking about over 70, they're gonna need more protein per body weight. And that's about 0.45 to 0.55 grams of protein per pound of body weight. So you take that 0.45 and you multiply it by however much you weigh, okay? And that's how you find out how much total protein you need to take per day, okay? For athletes, we're going up to 0.55 to 0.9 grams per pound. So let's say if we're talking about an athlete who is 200 pounds, and usually they go up to more than that. They go up to about 1 gram per pound. So they're taking in about, if they're 200 pounds, they're taking close to 200 grams of protein per day, okay? But for that, you need to have a much higher muscle mass. I know that nowadays, the high protein is really pushed. There are really no, and a lot of people kind of mix keto and high protein. Keto is supposed to be mainly fats and not as much protein. So we got to watch that. It's not like an unlimited amount of protein that can have its own problems as well. So try to stay within what I mentioned here. You can calculate it for your own body weight. This would be a good one to take a picture of if you guys want to kind of get have this for your reference. So the rest of the calories then should be from healthy fats. Now, what do I mean? Avocados, nuts, olives, olive oil, butter that's not heated, okay? Butter that is not heated, I want to specify. Regular fat dairy products, okay? So that's where we're getting the rest of our calories from based on how many calories we're taking in per day. So one thing that I want you to realize, you cannot have both high fat and high carb, okay? This is recipe for disaster. We either have to do a higher fat, or if we decide to do a diet where you're taking more carbohydrates, which is going to be your Mediterranean diet, okay, the fat cannot be that much, okay? So that's very important to realize. Fat and carbs together, that results in some sort of disaster in the body. So we either have to go low carb, high fat, or low fat, higher carb. So as I said, you can have a higher fat intake only if you're restricting your carbs. So let's talk about starchy carbohydrates. So what do I mean by when I say 130 carbs per day? What does that mean? Okay, so 2 medium baked potatoes, okay, is 46 grams of carb. So that's already close to like half of the carbs we should be taking per day, okay? For a regular potato, 1.5 of a medium sized baked potato is about 54 grams of carb, okay? Oats. Oats are used widely, oatmeal in the morning. So I'm going to come down lower to where it talks about the Quaker Oat Original. When you get oatmeal, please get it unsweetened. Don't have it sweetened, because then you kind of it defies the purpose. You know, you want to eat healthy. What I do generally with my oatmeal is I add some cinnamon into it, and I add some vanilla extract into it. Sometimes I add a little bit of peanut butter into it, and that enough. That you don't really need. I know some of us have that taste that we need to have something sweet, but that's enough. You don't really need anything else in there. The cinnamon itself gives it a sweet taste. The Quaker Oat Original, that is unsweetened, one packet is 18 grams of carbs, okay? That is a good amount of carbs in one setting, okay? Especially for breakfast. We shouldn't be going over 20 grams of carb for breakfast. We should have something that has more protein in it. So that's a very good one. The Trader Joe's one, which is the one that I normally get, I usually don't use the whole package. I feel the packages are pretty large. That's 26 grams of carbs, okay? Whole wheat bread, 44 grams for 2 slices. I know us Persians love our bread. So think about that. Just 2 slices gives you 44 grams of carbs. That's a lot. That's a lot. So as I said, you know, for breakfast, we really want to keep that lower at about 20 grams of carbs. So 1 slice is more than enough. Let me say something about whole wheat. Okay. When you buy packaged bread, oftentimes it may say whole wheat on there. The only way to tell, is it really whole wheat or not, is by checking the ingredient list in the back. If the first ingredient written down is enriched flour, then that is not whole wheat. The first ingredient has to be whole. It has to have whole something in it. Okay, so if it says enriched whatever flour, then that is not whole wheat anymore. So pay attention to that, because they don't have any certain restrictions over what they write on the actual bread. Brown rice, as you've known, all of these to complex carbohydrates. So brown rice and white rice have about the same carbohydrates. What's going to be different in them is the amount of protein it has. As you notice, and the fiber, amount of fiber it has. As you notice with this, it has 44 grams of carbs and has 5 grams of protein. White rice is not going to have that. Okay, so it's a little bit more complex. So when it is, as it's breaking down in the body, it doesn't become glucose molecules as quickly. Okay, and that's what it is with all of them, with all the complex ones. So to keep a low carb diet, okay, 2/3 cup of brown rice, cooked, I should have written that, is about 30 grams of carbs. So if you have 2/3 cup of brown rice for lunch and for dinner, that will make 60. And then you add a whole wheat toast in the morning, that's about 82 already, okay? Or some oatmeal in the morning, we're about 80, okay? Again, a medium-sized potato is also about 30 grams of carb, okay? So 80 is a good number to keep our carbohydrates, our starchy carbohydrates, okay? Our starchy carbohydrates, because there's lots of other things that we need to have during the day that are carbohydrates, but are not starchy carbohydrates, so our vegetables. So Broccoli, broccoli is wonderful. It actually decreases insulin resistance. It makes our cell more sensitive to insulin. So it's great for people with this problem. 1 cup of raw broccoli has about 6 grams of carbs. Okay, so as you see, we come from the starchy carbohydrates to your vegetables, there's a drastic reduction in the amount of carbs. Asparagus, one cup of cooked asparagus has about 8 grams of carbs, okay? And as you see, when we come into the vegetables, we are getting a lot more vitamins, minerals, and different types of antioxidants, okay? Mushrooms, very, very low in carbohydrate. For 1 cup of raw mushrooms, it's 2 grams of carbs, and 1 of it is fiber, okay? So the higher the fiber, the better it is. And mushrooms have very strong anti-inflammatory properties. So for people that may have some inflammation, it'll be helpful. And in this day and age, we have some sort of inflammation, all of us. Zucchinis, 1 cup of raw zucchinis is about 4 grams of carbs, okay? Spinach, 1 cup of cooked spinach. As you know, when we cook spinach, it really reduces in size. So 1 cup of cooked spinach is about 7 grams of carbs. 4 of those are fiber, so about half. 1 cup of raw spinach is about 1 gram of carbs. So if you're on a diet and you want to keep that low carb going, spinach is the perfect way to go, because it also has so much minerals and vitamins. So, and it is anti-inflammatory. It reduces damage to the DNA. So that is wonderful, because we're getting daily damage to our DNA because of everything that's around us. Cauliflower, so 5 grams of carbs. Now, with broccoli and cauliflower, they tend to be a little bit more starchy, but it doesn't matter. Let's put it that way. Restriction, there shouldn't be too much restriction in these. Okay. Lettuce, 1 cup of lettuce contains about 2 grams of carbs. So again, all of these are things that we should be concentrating on. Our plate should be about 75% vegetables and about 10% maybe the carbs and the rest protein. That's how our plates should look like. Cucumbers, 4 grams of carbs. They are very high in vitamins. They're not very high in vitamins and minerals, but they do have something called cucurbitacin, which is an anti-inflammatory. So I know we love our Persian cucumbers, and now they have it in all of the stores, which is wonderful. Chopped celery, 3 grams of carbs. So you get the idea. I don't want to go, well, it's finished now. But you get the idea. So vegetables, this is why vegetables are good, because they're packed with vitamins and minerals and low in carbohydrates, very little sugar. Our vegetables, I didn't have any of them that have the red color, that have the orange color. Those tend to be higher in sugar content. But they also have lots of anti-inflammatory, antioxidant properties as well. So the other part of our carbohydrates is our legumes, which is all of our beans, the different beans that we have. So let's go through this very quickly too, so that you kind of get an idea of how much you should be having, okay? So all of these are cooked. I think most of them are cooked beans. So per cup of pinto beans that are cooked in 1 cup, there's about 45 grams of carbs. So as you can see, they have a lot of carbs, but out of that 45 grams, 15 grams are fiber, okay? Which means that that carbohydrate is going to take a long time to break down into sugar, to break down into glucose. So That's what we want to, when we want to choose a carbohydrate to have, we want to look for the ones that have the highest amount of fiber. That reduces the least amount of problems in our body. Black beans this is for half a cup, it's 20 grams. So for a full cup, it'll be 40 grams of carbs, okay, and about 16 grams of fiber. Chickpeas has 35 grams of carb, and this is for 1 cup canned or cooked, okay. And it has, another thing is the protein content. The protein content of beans for people who are vegetarian and are not taking any meat. This is, the legumes become very important to get protein from. Kidney beans give you about 40 grams of carb for 1 cup of cooked kidney beans. And as you can see, it has about 7.5 grams of protein. So the protein, they vary slightly as far as how much carbs they have, how much fiber they have, and how much protein they have, but they are all high in fiber and and they give good amount of protein. So they're wonderful to have as part of our diet. So to keep to a low carb diet, your total carbs from starchy carbs or legumes should not exceed 80 grams of carbs, so that you can have the rest of your carbs to come from vegetables, from fruits, from nuts, olives, avocados, and dairy products, okay? Because all of those will have some carbs. So to keep a healthy low carb diet, we need to keep that starchy carbs somewhat lower than what that 130 that they talk about. Okay, Mediterranean diet has had a lot of hype recently. It does reduce inflammation in the body. So it's wonderful for our diabetic patients, although it does have a higher amount of carbohydrates. However, all the carbohydrates are your much complex carbohydrates. The basics of this diet is it's rich in vegetables, fruits, nuts, seeds, legumes, potatoes, whole grains, breads, herbs, spices, fish, seafood, and extra virgin olive oil. In moderation, they don't have as much chicken, poultry, or eggs. Cheese and yogurt, they eat in moderation as well. And they rarely eat red meat, okay? And of course, no sugar sweetened beverages, added sugars, processed meats, refined grains, refined oils, or other highly processed food. As you can see, whenever we're choosing a diet, the number one thing is that the diet that works is the one that we can stick to. And as you can see, all of them kind of follow the same type of idea, except keto, and we'll talk about that. It's get rid of highly processed foods, no sugar sweetened, get rid of sugar. So that's a commonplace for all of them. So with Mediterranean diet, about 50% of the total calories are from carbohydrates, okay? 20% are from sugars. Most of the carbohydrate intake are in the form of vegetables. So fiber, about 28 to 34 grams of fiber. Fiber has been shown to reduce colon cancer. People who do have a high fiber intake generally don't get colon cancer. This day and age, we have young people, very, very young people getting colon cancer, and that's one way to combat it. So increasing the fiber intake, they say for men, they should be taking about 34 grams of fiber per day, and for females, 28 grams of fiber per day. Generally in the standard American diet, we're not even hitting 10 grams of fiber a day. The total proteins is about 15% of daily calories, and total fats are about 25% of daily calories. and that's your Mediterranean diet. This is basically just goes through what are okay, what are some of the things that are okay, would be a good one to kind of just, take a picture of. I don't want to just go through it and list it, but this goes through all the stuff that is okay in a Mediterranean diet. So what kind of carbohydrates are okay in a Mediterranean diet? So about 75% should be vegetable, as I said, with the low carb as well, and the rest with other carbs and protein, okay? Look for real whole grain bread. And I mentioned that to you, that it should have that whole wheat written in the back in the ingredient list. Add legumes, at least, or beans at least twice a week for protein. Ideally 3 times. They consist of good carbohydrates while combining the protein as well. Do not consume a meal consisting of only carbohydrate. That should go with everything. That is recipe for disaster. When we have a very, very carbohydrate-rich food, that is when that insulin starts really rising and insulin resistance starts happening if we do it over and over again. So pasta should be not the main dish, but a side dish, okay? Or rice, or your bread. Prefer the whole fruit and not the fruit juice. For snacks, choose nuts or cheese, not crackers or cereal bars. For breakfast, avoid carb-heavy meals. Instead, choose eggs with vegetables or yogurt, Greek yogurt with nuts. Keto diet, I'm not a big keto diet prescriber. If people want to go on a keto diet, then I definitely am for it. I like keto diet for the younger people. I have the tendency to feel that it can be somewhat inflammatory, although because it reduces the sugar amount so much, it has the benefits. I think it overweighs the problems of inflammation. The keto diet that I'm going to discuss here with you is by Dr. Vestman. He is pretty much the keto, the one who's done the most amount of research on keto diet. He was trained by Dr. Atkins, and this is the diet that he gives his patients. So the next few slides, if you're interested in doing a keto diet, this came straight from him, so you want to take some pictures of it. So this is how he has his keto diet, which is different from some of the keto diets that you may see on the internet. So when hungry, eat as much as you want of the following foods: beef, whether it's hamburger, steak, pork, ham, bacon, lamb, sausage, pepperoni, hot dogs, or other meat. So this is where I kind of run into problems with this, because I feel that there are some processed meats in there which are inflammatory. He told us a story of one of his patients that basically got all his meat from the 99-cent burger from McDonald's. And that's how he did his keto diet. He deals with a lot of, he lives in New York, and some of his patients financially are not well off. So that's how he did a keto diet. And he lost a lot of weight, and he did improve his sugars, his triglycerides, all of those did improve. So this is where I run into problem. I feel that if you want to do a keto diet, try to stay away from processed foods as much as you can, processed meats as much as you can, and try to keep it clean. Poultry, chicken, turkey, duck, fish and shellfish, any fish, including tuna, salmon, catfish, tilapia, trout, shrimp, scallop, crab, and lobster. Eggs, whole eggs, including yolks and whites. So unlimited. You can eat as much of these as you want until you're comfortably full, okay? Don't avoid fat in real foods. Don't add fat if you're trying to lose fat weight. Okay, so don't add butter, don't add, and we'll go through that. So how much of leafy vegetables are we really having in a keto diet? Okay, so of course there's no real carbs except vegetables in a keto diet. So 2 cups of, as you can see, of those leafy greens, 2 cups a day, okay, measured uncooked. So that's not much. And your other vegetables, which includes your artichoke, asparagus, broccoli, so all of those except what you don't see in there is potatoes and sweet potatoes, okay? So these vegetables, 1 cup, measured uncooked again. So these foods are allowed in limited amounts. So cheese, up to 4 ounces a day. So including all types of cheese. Cream and oils, up to 2 tablespoons a day. Okay, that includes butter, half and half, whipping light, mayo, or actually mayo is 2 tablespoons a day, but sour cream. So those are all your creams and oils, up to 2 tablespoons a day, mayo up to 2 tablespoons a day. So a lot of people tend to think that they can have these unlimited when they're on a keto diet, but that's not the case. Olives up to 6 a day, avocado up to half of a fruit a day because it does have carb content. Lemon and lime juice up to 2 teaspoons a day. Again, the carb content in lemon is actually a little high, so that's why he has that. Soy sauce up to 2 tablespoons a day. Pickles, dill, or sugar-free up to 2 servings a day. Okay, so that is the keto, and then 0 carb snacks, sugar-free Jell-O, pork rinds, pepperoni slices, low carb jerky, and boiled eggs. Those can be unlimited snacks. Okay, because it is a higher fat content, it generally fills us up, so we don't eat as much on a keto diet. So some of the things that are different in this real keto diet versus the internet keto is measuring ketones is not required. Some people think that they need to pee on this ketone sticks that tells them whether their body is in ketosis or not. He doesn't recommend that. He thinks it's extra cost that's unneeded. If you keep with this diet, you will be in ketosis. Macro calculations is not required, meaning you don't need to figure out how much of fat you're having, how much of carbs you're having, how much of protein. You just keep to the diet. Medium chain triglycerides or MCT oils or ketone drinks or pills are not required. He actually is against those. Fasting is not required. Nuts, nut flour, and butter, nut butter, I should say, nut flour or nut butter are not okay. Okay, so peanut butter, all of your nut butters are not okay in a keto diet. It has too much carbs and it'll push out of ketosis. Vegetables are not unlimited. Net carb is not as strong as total carbs, which was something we discussed earlier as well. Artificial sweeteners are not forbidden. So people can have artificial sweeteners. And that's another place where I'm kind of iffy about. Expensive, clean food is not required. Cheese, fats, and oils are not unlimited. Okay, so I hope that this gives you, for those of you who have thought about a keto diet, I hope that this gives you a good place to start and just understand some of the things that you may find on the internet that may not necessarily be so or required. Okay, so what else do you need to know about diets? Portion sizes matter. Okay, not necessarily with keto diet, because as we know, our body kind of figures out how much we need to eat, but when we are eating carbs, portion sizes matter. And so let's go through these portion sizes, and this would be the last of what I'm going to talk to you about. So 1 serving of protein is about a palm of our hand. That's about 20 to 30 grams of protein. Okay. Generally, at each serving, we should have about 20 to 30 grams of protein. So that's a very easy way to measure. Am I having 20 to 30 grams or am I having way more? A serving of vegetable, and we're supposed to have about 8 to 10 servings of fruits and vegetables a day. That should be 2 from fruits and mostly from vegetables. A serving of vegetable is about a fist. 1 serving of carbs is a cupped hand. So when we, and this is about 20 to 30. So if we're measuring potatoes or our rice, that's what we need to consider. About that much is about 20 to 30 grams. Okay, so this kind of makes it easy. It brings a little bit of attention of how much am I really having. And as far as a serving of fats go, it's about the size of your thumb. Okay, that's about 7 to 12 grams of fats. For each meal, 1 to 2 pounds of protein dense food. Now, this is kind of like if you're a female versus a male. 1 to 2 fists of non-starchy vegetables, 1 to 2 cups of carb dense foods. So as we talked about those low carb, this is not considering the type of diet. So as we talked about that low carb diet, this is talking a little more than that. But as far as protein goes, I did want you to, oops, what did I do? I did want you to kind of just figure out how much that protein is, okay? All right, and this is, oh, physical activity, one more, sorry about that. Physical activity, let's not forget about that. There are several purposes, there's a couple of purposes for physical activity. It's to increase, when we do more physical activity, we're using more energy, more glucose, more place for the food that we eat, the glucose that is sugar that we eat to go and get stored in our muscles, okay? Increasing muscle mass. So with physical activity to increase our muscle mass, it will help with to also increase that glycogen storage that we talked about. Okay, both of these will increase insulin sensitivity. So we become less resistant, the cells start listening more to our insulin. What is required as far as physical activity goes? Guidelines say 150 minutes per week. That's about 30 minutes per day, 5 days a week of moderate intensity activity. And 2 to 3 days of weight training, okay? 2 days at least of weight training. Now, not everybody is there. I always tell my patients to just start by walking. However much that you can walk and start increasing from there. We know that 10,000 steps per day, and now we have ways of checking that with like smartphones and iWatches and other type of watches that will measure our steps per day. There's something magical about that 10,000 steps per day. Okay, it's been shown in many studies that it establishes balance in our hormones and it brings back health. So if we cannot do exercise, that's okay. I honestly think that 10,000 steps per day or 70,000 steps per week is good if that's where you can be, especially for our elderly population where they may have some joint issues and problems and it may be hard for them. So that is it for my presentation tonight. Thank you all so much for patiently listening to me. I know some of it did get boring at times. So I will take, let me stop sharing this. I will take your questions.
Thank you, Kamelia John. That was excellent.
You're welcome. You're welcome. I hope it was helpful.